Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Mersa Nurain Kausar. Please let me to present the result of our study entitled Development and Validation of the Knowledge, Attitude and Practice Questionnaire for Community Pharmacy Personnel in Tuberculosis Case Detection, Drug Monitoring and Education. The authors are Mersa Nurain Kausar, Evi Fitriana, Herunisa, Muhammad Akbar Bahar, Sofa De Alfian, and Ivan Surya Pradipta. This research is collaboration of Universitas Pajajaran, Universitas Sumatera Utara, and Universitas Hasanuddin. Introduction. The community pharmacy has been identified as a potential facility for detecting TB cases and improving TB treatment outcomes. Studies in high-burden TB countries report that most patients with tuberculosis initially present at the pharmacy for the first aid medication. One of the factors that led to community pharmacies being used for initial TB medication among patients with tuberculosis is lack of access for healthcare facilities. However, improper management of patients with tuberculosis in pharmacy can lead to delayed diagnosis and inappropriate treatment. A study in Indonesia estimates that the total delay in tuberculosis diagnosis and treatment is caused by various factors, including visiting a pharmacy for first aid. Improper management of patients with tuberculosis in pharmacy may result from the poor tuberculosis knowledge, attitude, and practice of pharmacy personnel. Therefore, improving tuberculosis care in community pharmacies is necessary to improve TB case detection and treatment outcomes. However, current TB knowledge, attitude, and practice instruments used to evaluate pharmacy personnel continue to focus on TB case detection only. Because the potential role of the pharmacy in tuberculosis management extends beyond tuberculosis case detection, a comprehensive instrument is required to cover the assessment of TB drug monitoring and education activity. This instrument can be used to assess the current knowledge, attitude, and practice situation and to evaluate programs aimed to developing additional intervention for engaging community pharmacy personnel in TB management. The method of this study. This study was conducted into two phases. First, we developed the questionnaire, which include framework development, item generation, item screening, and pretesting. Second, we validate the questionnaire with 400 participants from Bandung City, Bandung Regency, Medan City, and Makassar City using various analyses, including participant analysis, item discrimination, item difficulty, individual item content validity index or I-CVI, and confirmatory factor analysis. Confirmatory factor analysis consists of adjusted goodness of fit index, comparative fit index, non-form fit index, root mean square error and approximation, and standardized root mean square residual. Next analysis were Cronbach alpha and test-retest reliability using Pearson's correlation and intraclass correlation coefficient or ICC. The result of this study. The instrument included 63 items covering fundamental knowledge, attitude, and practice for TB case detection, drug monitoring, and education. The items were divided into 4 sections. 18 items sociodemographics, 18 items knowledge, 18 items attitude, and 9 items practice. The individual item content validity index or I-CVI score of sociodemographic and knowledge, attitude, and practice items were 1 each. Cronbach's alpha coefficient for knowledge was 0.75, for attitude was 0.91, and for practice was 0.95. According to the result of the retest reliability with Pearson correlation coefficient, the correlation coefficient of knowledge was 0.8, for attitude was 0.55, and for practice was 0.91 with all p-value less than 0.01. The intraclass correlation coefficient for knowledge was 0.91, for attitude was 0.71, and for practice was 0.95. The confirmatory factor analysis model's parameter value meet all the criteria. Conclusion: a valid and a reliable instrument for assessing the knowledge, attitude, and practice of community pharmacy personnel in TB case detection, drug monitoring, and education in Indonesia can be used to develop effective strategies to engage community pharmacy in the management of TB. Thank you for your time and attention. Wassalamualaikum warahmatullahi wabarakatuh.